Hi, I'm Dr. Michael Denk. I trust you'll find the following seminar both interesting and educational. And what I want to do is show you before and afters of breast augmentation, liposuction, tummy tucks, the combination of those things, or mommy makeover, and then lastly Brazilian butt lifts for fat grafting and liposculpture, which seems to be, it's very popular. So this gal is a before and after. In a side view. This is another gal. This gal's in her mid-30s, has had her children. A nice example of somebody who is asymmetrical when they come in. And my job is to point that out to them, not in a judgmental way, but in a natural way. It's rare to see two breasts the same. I'm quick to say that breasts aren't twins, they're sisters. And this lady's a great example. Her post-op picture is not perfect, because they're not the same. They're not the same before. And sometimes trying to make them the same, you need to put an extra scar on to move the nipple, which people don't tolerate or like. Sometimes you try to do too much. That's not worth it. This is another gal in her, again, late 20s. She's also had her children. Her scar and the previous gal's scar are within their areola. Not at the edge of the areola, but within the areola, from about 4 o'clock to 8 o'clock. And when that heals well, you just cannot see it. Back in the 80s and 90s, we put them in the axilla. But with the advent of aerobics classes and sneaky and curious women, they can see that little line under the armpit. And there was no Facebook then, but they still, found people out. And if a patient doesn't need skin removed, doesn't have too much excess skin or quote droopiness, then an implant alone is fine. And that's a wonderful place to put the scar. So then when she's in front of the mirror and naked in front of whom she wants to be, you can't see the scar. And the size of the implant is usually chosen by the patient. So the way that I size people is my nurses, mainly Jennifer, who you'll meet later, has patients physically put a bra on, put an implant in, put their t-shirt on, or their tops, or t-shirts we may have, and look in the mirror. So it's truly like shopping for blouses. I'm the vehicle that gets you where you want to be, but one of the nicest things about it is you're in control. You try it on, you see what you like. And some people are pretty quick. Some people bring a girlfriend, some people bring a husband, and we always have them do it on 2 different occasions. Usually they stay about the same size. If the husband is really keen, which some are, the husband tends to dial him up because he gets excited, and then when he realizes what he's bringing home, he dials it back down. This gal is somebody who has a little bit of deflation, a little bit of droop, and she told me, I really want to look natural. I don't want extra scars. In a bra and a bikini, my breasts will be fine where the bra and the bikini take them. So her scars are in the same location. And again, you notice not exactly symmetrical either side. Oftentimes, people ask, well, you're going to use 2 different size implants? If you're using saline, are you going to fill them differently? We do occasionally, but typically use the same size implant. There are hundreds of styles and sizes, so we have that ability to put a different size or even a different shape in one side than the other. The nice thing about breast augmentation, if done correctly under the muscle, a lot of women complain of this upper chest or what we call upper pole sort of hollowness. And with the implants under the muscle, you can truly have a natural slope to your breast and have upper pole fullness. Now this gal is an example of somebody who wanted to be a little bigger. She was fine with a little skin needing to be removed, and you can see the scars around her areola. Her areola stretched out a little bit because it's a larger implant. But her tan lines are proof that it doesn't seem to bother her. And a similar side view. And again, there is no use to have a breast augmentation if you're going to trade small, droopy, excuse that word, breasts for big droopy breasts. And it's not why anybody has an augmentation. You want more, playful, sporty, perky, fun. This is another example of somebody, again, size is really determined by the patient. You can ask my staff. I am certainly someone who always talks people down from the ginormous. And we live at a time when women from the ages of 25 or 20 to 70 can have whatever breast they like. Most women, it's about self-esteem and it's about wearing clothes. And most women want to have nice breasts. And it's surprising to me how many primary breast augmentations I do in a 55-year-old or even a 60-year-old. 3 months ago, a gal came in with this little skin cancer, and she said, "Can you take the skin cancer off and have an augmentation at the same time?" I said, "Sure I can." 61 years old. And there's a side view. This is an example of someone who came to me with implants already. Doesn't like the position of her nipples. They're a little high. They're not in the center of the equator. The breast is a little deflated, a little small, and the upper pole is lacking. So we changed her implants out and went through her original scars are around the areola, straight down like a lollipop, and she has a little bit of a scar underneath. So some of those scars were revised. You can still see the scar around the areola. The nice thing is that she's happy with the size. Again, tan lines always tell me that they're satisfied. The other thing that's nice is that the nipple and areola complex is in the middle of the implant. It's at the equator where hopefully it'll stay forever.
Do you always go under the muscle for the implants?
90% of the time. 90% of the time. Once in a while, if there's someone who's a serious bodybuilder, not a CrossFit trainer or a serious athlete, but somebody who competes. I've had multiple CrossFit trainers have them under the muscle, and they do fine with push-ups, pull-ups, bench press. In this area, the benefits from under the muscle are that upper pole fullness. Also, in very thin gals who have very little bit of breast tissue, it hides the implant. It can look more natural. The downside under the muscle, there's a little bit more discomfort involved initially. But in terms of the long-term result aesthetically, and then the capsular contraction rate and some of the unwanted side effects are definitely less when put under the muscle.